Hi, I'm Dr. Neil Nathan. Today I'd like to give the third installment of these Instagram discussions focused around the release of my new second edition of the book Toxic. One of the key things that we're going to talk about is mold toxicity. Now, in order to really get you engaged in this subject, let's talk about the symptoms of mold toxicity so you can begin to think about, could this apply to you or your loved ones or friends or someone in your community? So mold toxicity is a systemic form of inflammation so that virtually any system of the body can have symptoms, and often systems and symptoms are multi-involved. First of all, almost everyone with mold toxicity will have some degree of fatigue and will have some degree of cognitive impairment. And then we can go from top to bottom. Symptoms can include headaches of every type. It can include sinus symptoms of every type, um, gastrointestinal symptoms of every sort, including gas, bloating, distension, diarrhea, constipation, reflux, or abdominal pain. It can include neurological symptoms like um, peripheral neuropathy. It can include psychological symptoms like a new onset of or worsening of anxiety, panic, depression, OCD, depersonalization, derealization, or mood swings of any type. It can also include skin symptoms like rashes of various sorts, tendency to hives, tendency to itching in different areas, which is triggered by usually mast cell activation, which is a downstream consequence of mold toxicity. Shortness of breath, air hunger, heart palpitations, temperature dysregulations, autonomic dysfunction, all of those are potential symptoms of mold toxicity. So if a medical practitioner is not aware of this, if you present with some or all of these symptoms, it is likely that you will not be understood and you will not receive the correct diagnosis. Unfortunately, this is a travesty. I estimate that there are millions of people in this country right now who have some of these symptoms going undiagnosed, therefore untreated. So it's really important to understand what you're experiencing as a key to figuring out how to go get it diagnosed and how to get it treated. Now, in later discussions, we'll talk about diagnosis in more detail. But for today's discussion, it's important to understand that inflammation triggered by mold toxin, it's what's triggering these varied symptoms. Now, we're all different based on your own unique biochemistry, your experiences in life, and your genetics. You could have four people in the same household, all of whom have different symptoms, all from the same mold exposure. So this can become complicated and confusing unless you begin to look at the bigger picture. So if you have any of these constellations of symptoms, this is something to be aware of. On a different level, mold toxicity will also trigger virtually every known form of autoimmune condition. So if you have an autoimmune condition, you should at least be considering the possibility of mold toxicity as a player here. A mold toxicity can also be mistakenly um, excluded from the diagnosis of common conditions like chronic fatigue syndrome, fibromyalgia, asthma, all of which have their own diagnosis. But if you're not thinking mold toxicity, you may not be getting to the cause of those. And so think mold toxicity with any symptom unusual presentation. Now, particular symptoms of mold toxicity that jump to mind as soon as they occur are ice pick-like pains, electrical sensations or pains, a perception of vibration in any part of the body is unique to mold toxicity and Bartonella. EMFs can cause that as well. Um, but especially be aware that sensitization to anything, including light, sound, touch, chemicals, smells, food, or EMFs, is almost always triggered by mold toxicity. So mold toxicity has a wide range of presentations, and I hope this will understand for you how to begin to think about the symptoms you or your loved ones are having so you can get it into the right diagnostic category. Thank you.